Hi there, I'm Esther. Today I wanted to talk about diabetes mellitus, or DM, and provide some education about this chronic condition. For starters, what is diabetes mellitus? Diabetes mellitus refers to a group of diseases that affect how the body uses blood sugar, or glucose. Glucose is an important source of energy for the cells that make up the muscles and tissues. It's also the brain's main source of fuel. The main cause of diabetes varies by type. But no matter what type of diabetes you have, it can lead to excess sugar in the blood. Too much sugar in the blood can lead to serious health problems. Potentially reversible diabetes condition includes prediabetes. Prediabetes happens when blood sugar levels are higher than normal, but the blood sugar levels aren't high enough to be called diabetes, and prediabetes can lead to diabetes unless steps are taken to prevent it. Next, we need to know the symptoms, causes, risk factors, complications, and preventative steps to take for diabetes mellitus. Let's start with symptoms. Diabetes symptoms depend on how high your blood sugar is. Some people may not have symptoms. Some of the symptoms of type 2 diabetes are feeling more thirsty than usual, urinating often, losing weight without trying, presence of ketones in the urine, which are a byproduct of the breakdown of muscle and fat that happens when there's not enough available insulin, feeling tired and weak, feeling irritable or having other mood changes, having blurry vision, having slow healing sores, getting a lot of infections such as gum, skin, and vaginal infections. Type 2 diabetes can develop at any age. Type 2 diabetes is more common in people older than 40, but type 2 diabetes in children is increasing. Next, let's dive into some of the causes for diabetes mellitus. To understand diabetes, it's important to understand how the body normally uses glucose. Insulin is a hormone that comes from a gland behind and below the stomach, pancreas. The pancreas releases insulin into the bloodstream. The insulin circulates, letting sugar enter the cells. Insulin lowers the amount of sugar in the bloodstream. As the blood sugar level drops, so does the secretion of insulin from the pancreas. Now, let's cover how glucose works. Glucose, a sugar, is a source of energy for the cells that make up muscles and other tissues. Glucose comes from two major sources: food and the liver. Sugar is absorbed into the bloodstream, where it enters cells with the help of insulin. The liver stores and makes glucose. When glucose levels are low, such as when you haven't eaten in a while, the liver breaks down stored glycogen into glucose. This keeps your glucose level within a typical range. The exact cause of most types of diabetes is unknown. In all cases, sugar builds up in the bloodstream. This is because the pancreas doesn't produce enough insulin. Now, let's look at some of the risk factors for diabetes mellitus. Risk factors for diabetes depend on the type of diabetes. Family history may play a part. Race or ethnicity also may raise your risk of developing type 2 diabetes. Although it's unclear why, certain people, including Black, Hispanic, American Indian, and Asian American people, are at higher risk. Prediabetes, type 2 diabetes, and gestational diabetes are more common in people who are overweight or obese. Next, let's cover the complications that can be caused by diabetes mellitus. Long-term complications of diabetes develop gradually. The longer you have diabetes and the less controlled your blood sugar, the higher the risk of complications. Eventually, diabetes complications may be disabling or even life-threatening. In fact, prediabetes can lead to type 2 diabetes. Possible complications include heart and blood vessel or cardiovascular disease. Diabetes majorly increases the risk of many heart problems. These can include coronary artery disease with chest pain or angina, heart attack, stroke, and narrowing of arteries, or atherosclerosis. If you have diabetes, you're more likely to have heart disease or stroke, nerve damage from diabetes, or diabetic neuropathy. Too much sugar can injure the walls of the tiny blood vessels, or capillaries, that nourish the nerves, especially in the legs. This can cause tingling, numbness, burning, or pain that usually begins at the tips of the toes or fingers and gradually spreads upward. Damage to the nerves related to digestion can cause problems with nausea, vomiting, diarrhea, or constipation. For men, it may lead to erectile dysfunction. Kidney damage from diabetes, or diabetic nephropathy. The kidneys hold millions of tiny blood vessel clusters called glomeruli that filter waste from the blood. Diabetes can damage this delicate filtering system. Eye damage from diabetes, or diabetic retinopathy. Diabetes can damage the blood vessels of the eye. This could lead to blindness. Foot damage. Nerve damage in the feet or poor blood flow to the feet increases the risk of many foot complications. Skin and mouth conditions. Diabetes may leave you more prone to skin problems, including bacterial and fungal infections. Hearing impairment. Hearing problems are more common in people with diabetes. Alzheimer's disease. Type 2 diabetes may increase the risk of dementia, such as Alzheimer's disease. Depression related to diabetes. Depression symptoms are common in people with diabetes. Last, let's cover diabetes prevention. Healthy lifestyle choices that help treat prediabetes, type 2 diabetes, and gestational diabetes can also help prevent them. It is important to eat healthy foods. Choose foods lower in fat and calories and higher in fiber. Focus on fruits, vegetables, and whole grains. Eat a variety to keep from feeling bored. Get more physical activity. Try to get about 30 minutes of moderate aerobic activity on most days of the week. Or aim to get at least 150 minutes of moderate aerobic activity a week. For example, take a brisk daily walk. If you can't fit in a long workout, break it up into smaller sessions throughout the day. Lose excess pounds. If you're overweight, losing even 7% of your body weight can lower the risk of diabetes. But don't try to lose weight during pregnancy. Talk to your provider about how much weight is healthy for you to gain during pregnancy. To keep your weight in a healthy range, work on long-term changes to your eating and exercise habits. Remember the benefits of losing weight, such as a healthier heart, more energy, and higher self-esteem. Sometimes drugs are an option. Oral diabetes drugs, such as metformin, may lower the risk of type 2 diabetes. But healthy lifestyle choices are important. If you have prediabetes, have your blood sugar checked at least once a year to make sure you haven't developed type 2 diabetes. If you think you or your child may have diabetes, or if you notice any possible diabetes symptoms, contact your healthcare provider. The earlier the condition is diagnosed, the sooner treatment can begin. If you've already been diagnosed with diabetes, after you receive your diagnosis, you'll need close medical follow-up until your blood sugar levels stabilize.